Hello everyone and welcome back to my YouTube channel. So if you are new here, this channel is your number one place for simple, for clear and practical health and public health education. So for anyone working in health, in medicine, in environmental health, health planning or project management and many more. And if you have been here before, thank you so much. Your support means the world to me, and I promise to keep bringing you quality content. So today we are talking about something that every single health student, every project manager, every planner, every researcher, and everyone working in health or health related programs need to know. So we are talking about the logical framework, also known as logic model. And by the end of this video, you will be able to answer 3 questions. Number 1, what is a logic model? Number 2, what are the parts of a logic model? Number 3, how do you build one step by step? So I will use real simple examples that you can relate to. So stay with me till the end, it's going to be worth it. Now let's start from the very beginning. What is a logic model? So a logic model is a diagram, a visual picture that shows how your project works. So it connects everything from the sources that you have to the activities you will do and to the results you want to achieve. So think of it like a roadmap. Before you travel somewhere, you look at a map so that you know the route, where you will start, what roads you will take, and where you end up. So a logical model does the same thing. It shows the journey from the start to finish. Now here is what I want you to really understand. A logical model is not just a chart you fill in because your supervisor told you to do so. It is a thinking tool. It forces you to ask, does my plan actually make sense? If I do these activities, will they really produce the results I want? That is the logic in logic model. So your project must have logic. It must make sense from beginning to end. So a logic model has 5 main parts. I will explain them one by one and then we'll put them all together with an example. So the 5 parts are inputs, processes, outputs, outcomes, and impact. So let us go through them one by one. So the first part is inputs or resources. So inputs are everything that you need to start your project. These are your resources. So think about it this way. Before you can cook a meal, you need ingredients, you need a pot, you need fire, and you need a cook. These are your inputs. So in health projects, your inputs could be money, staffs, frontiers, equipment, vehicles, or even demanding from the community, meaning people actually want the service you are offering. So without inputs, nothing moves. This is where everything begins. So the second part is processes or activities. So processes are what you do with your inputs. So these are your project activities. So using our cooking example, the process is actually cooking, cutting the vegetables, adding ingredients, waiting for it to be ready. So in health project, your activities might be training health workers, distributing medicine, running community health education sessions, or conducting home visits. So the question to ask here is what we would do to reach our goal. Let's now talk about the third part, which is outputs or immediate results. So outputs are the immediate direct results of your activities. So they are things you can count. So back to our cooking example, the output is the finished meal, the plate of food on the table. You can count it. So in health projects, outputs could be the number of health workers trained, the number of medicine distributed, the number of education sessions held. So I want you to take note of this. Outputs alone do not tell you if the project was successful. They just show you that something was done, but they are important stepping stones. Let's talk about the fourth part, which is outcomes or expected changes. So outcomes are the real change that happens because of your project. This is where things get exciting. So in health project, outcomes are the changes in knowledge, in behavior or health status. For example, more people using family planning, fewer children getting sick, or more people knowing their HIV status. Now, there are two types of outcomes. There is a short-term outcome that you will see during the project, and there is a long-term outcome that develop over time. So outcomes are usually measured using percentages or proportions. For example, a 30% increase in the number of women attending antenatal care. Let's now look at the big picture, which is impact. So impact is the big long-term effect of your project on the overall problem. It is the reason why your project exists in the first place. So in cooking, the impact is that over time the family's health, the children have more energy to go to work and to go to school. So in health project, the impact might be reduced maternal mortality, reduced child death, or any improved quality of life in the community. So impact takes time. You may not see it immediately, but a well-run project should contribute to it. So remember this by using your 5 fingers. The first finger is your inputs, the second is processes, followed by outputs, outcomes, and impact. Now let us bring all 5 parts together with a real health project example. So we are going to look at a family planning project. So imagine your community has a problem, too many unplanned pregnancies, and as a result, maternal and infant mortality is high. So your organization wants to do something about it. Let us build a logic model together. So the inputs, what do we need? We need health workers. We need money to run the program. We need family planning suppliers like pills, condoms, and we will need demand. Women, men in the community want these services. Processes. We will educate men and women about the benefits of family planning. We will distribute family planning suppliers in the community. We will train our health workers to give good counseling, and we will hold community meetings. Outputs. What can we count? So we will count the numbers of education sessions held, the number of community members who attended, the number of family planning suppliers distributed, and the number of health workers trained. What about outcomes? What changes do we expect to see? So we expect more women and men to start using family planning methods. We expect men to become more involved in family planning decisions. We expect women to have better access to pills, and we expect more quality counseling at the health facility. So now, what about impact? What is the big picture? If our outcomes are achieved, over time we will see the reduction in unplanned pregnancies and reduction in the maternal mortality. So this is the impact. Now, do you see how powerful this tool is? It connects every resources, every activity, every result in one clear, logical picture. Isaac, can you help me how to build a logic model? Don't worry, I'm going to show you how to build a logic model from start to end. Now, I want to share a technique that I personally love. It is called the backwards approach. So instead of starting with the inputs and working forward, you start with the outcome, what you want to achieve, and work backwards to the inputs. So this approach is brilliant because it keeps your focus on the goal at all times. So let me show you how it works using diarrhea example. So I want you to know 4 steps. Step 1, ask, what is the long-term outcome we want? Then answer, reduce diarrhea cases in children and increase safe water storage. Step 2, ask, what inputs do we need to achieve that outcome? Give answers. We need to train educators, ORS distributed, communities trained, safe water committees formed. Step 3, what activities or processes will produce those inputs? Give answers. Training sessions, distribution campaigns, community education. So the last step, ask, what inputs or resources do we need to learn those activities? Give answers. We need money, we need staff, we need supplies, we need community demand. And just like that, you have your complete logic model. So working backwards forces you to make sure that every activity has a clear purpose. Nothing is random. So try this technique the next time you'll be designing a project or writing a research proposal. It will change the way you think. So before I finish, I want to quickly explain something that many students confuse: the difference between a conceptual framework and a logic model. So I want you to understand this. A conceptual framework shows the big picture. So it maps out all the factors like social, economic, environmental, individual that affects health problems. So it shows why the problem is there at multiple levels. So it does not focus on your project specifically, but it shows the whole situation. But a logic model, on the other hand, is focused on your project. So it shows what your project will do and what your project expects to achieve. So I want you to think of it this way. The conceptual framework is the map of the whole forest, while the logic model is the specific path you walk through that forest. So both tools are important. The conceptual framework helps you to understand the problem, and the logic model helps you to plan your solution. Okay, my friends, let's quickly summarize what we have covered today. So a logic model is a diagram that shows the line flow of your project from inputs to processes to outputs to outcomes and finally to impact. So it organizes your thinking, helps your team communicate, identify projects, and guides your monitoring and evaluation. So you can build it forwards or backwards, but I recommend starting from the outcome and working backwards for the best results. And remember, a logic model is different from the conceptual framework. So the conceptual framework is the big picture, while the logic model is your project plan. So if this video helped you today, please do me a big favor, click the like button and subscribe to this channel. So every like, every subscription, every comment, it tells me that this work makes a difference, and it helps YouTube to show this content to more students who need it. So if you have a question or a topic you want me to cover, drop it in the comment below. I read every single one. Thank you so much for watching. This is Isaac Mwansa, and I will see you in the next video. Take care of yourself and keep studying.